Hello, and welcome to my presentation on the protocol and preliminary findings of a realist review exploring what methods for evaluating social prescribing work, for which intervention types, for whom, and in what circumstances. My name is Megan Elliot, and I'm the Senior Research Assistant for the newly formed Wales School for Social Prescribing Research. In Wales, there are multiple models of social prescribing based in either primary care or the community, facilitated by county voluntary councils and other voluntary sector organisations. Roberts et al. Defines social prescribing as individuals being referred or self-referring to non-medical interventions run by a third-party organisation in order to contribute to their general health and well-being. Social prescribing interventions are complex. These interventions often involve multiple stakeholders, multiple referral pathways, large variability between programme structure, intervention type, staff responsibilities, a broad target patient group, and a range of outcome variables. As such, evaluating social prescribing interventions is challenging, and to date, the literature supporting the efficacy of social prescribing is weak. Systematic reviews of the social prescribing literature have highlighted the lack of rigour and high risk of bias in social prescribing evaluations to date. These reviews call for a coordinated framework for evaluating social prescribing interventions in order to strengthen the evidence base and determine how social prescribing may have an impact upon people's health and well-being. In response, researchers at the Wales School for Social Prescribing Research have been commissioned by Health and Care Research Wales to develop a social prescribing evaluation methodology. More information about WISPR can be found on our website, www.wisper.wales. The first stage in this programme of research involves a review of the existing published and unpublished literature around social prescribing evaluation. Conclusions from the realist review will inform future stages of the programme of research, which will include using consensus methods to develop a social prescribing evaluation framework with stakeholders from third sector, primary care, local authority, policymakers, statutory organisations and academics, followed by a virtual commissioning process to test the framework in simulation and in practice. A realist review takes an iterative and multi-stage approach to searching the literature. This review follows steps set out by previous realist syntheses. The first stage involves identifying the review questions, and for this review we've specified 5 questions which explore when social prescribing evaluations occur, and why, for whom, to what extent, and how do certain evaluation designs, methods and methodologies work or not work for social prescribing evaluation. We searched the published literature using academic databases and then explored the grey literature using grey literature databases, local authority websites, third sector websites and Primary Care 1. In addition, we put out a call to the Wales Social Prescribing Research Network for members to send us any public-facing evaluation and monitoring reports from their social prescribing projects. After duplicates were removed, we were left with 3,048 records for title and abstract screening. This was carried out by myself, and 20% of the abstracts were checked by a second reviewer. This left 159 full text documents, and once these were reviewed, we were left with 95 articles to review. Within the review team, we decided to split the documents by methodology for subcase reviews before bringing them all together. When we split them, we were left with 23 qualitative studies, 19 quantitative, 12 mixed methods, 8 systematic reviews, and 33 grey literature reports and documents. Using a realist synthesis appraisal form, each document will be appraised, and we're currently in the process of doing this now. We'll assess the relevance of the document to the research questions and review, and then assess the rigour of the document and the risk of bias. This will lead to an overall judgment of the usefulness and relevance of the study to identify the key studies that are rich in descriptions of processes and context to give us information on the context, mechanisms and outcomes and the programme theory. Each subcase of papers will be coded to identify themes and context, mechanisms, outcomes relating to the research questions. Context mechanism outcome configurations, known as CMOCs, will be built within the identified themes and agreed with the review team. From these constructed CMOCs, if-then statements will be created by the reviewers in relation to the research questions and programme theory. Data and inferences drawn from within each of the subcases will then be integrated and triangulated to produce a final programme theory, set of CMOCs, and if-then statements to draw meta-inferences. At the end of the synthesis process, principles of good practice in evaluating social prescribing will be identified for academics and practitioners within the context of these 5 research questions. This will be used to inform the following stages in the development of the evaluation methodology. As I've mentioned, we're still in the data extraction stage of the review, and within this working to identify common themes and then code for the CMOCs in individual papers within our methodological subcases. Some preliminary themes that we have identified in the paper that we have analysed so far include a general lack of detail about the methods and study design. This also poses a challenge for this review as it limits our ability to identify the mechanisms that are generating the outcomes in a given context. This provides a strong case for support for the reporting standards that WISPR have been commissioned to develop for social prescribing research and evaluation. We split the papers based on methodology, but as we've been reviewing them, we found that a number of papers in the qualitative and quantitative subcases are reporting on the same broad and mixed method study, with the same population and the same sample. Despite this, there is little triangulation of the findings, and the findings are rarely linked in any meaningful way that might allow for further interpretation or exploration of the findings. Linked to this is the contrast between mixed method studies that are designed to collect data sequentially or in parallel. Sequentially designed studies allow the researchers to use the qualitative data collection as an opportunity to explore the findings from the quantitative data collection, and can provide a contextual background to the findings. However, data collection in parallel seems to be more common and pragmatic, given the constraints on researchers. However, a lot of the studies do not make it clear which design they are using. For the qualitative papers that we have analysed so far, a common theme seems to be a lack of clarity and a risk of bias based on the sampling and recruitment strategy used. One strategy is to ask the social prescribers, the practitioners, to identify participants to be interviewed and approach them to gain their consent to be contacted by the research team. This results in a risk of bias in the findings reported. However, some studies have reported attempts to randomly contact participants with little success in gaining the sample size required. The composition of the research team seems to be highly varied in the literature, with a contrast between research teams that are completely independent from the intervention, compared with integrated teams that include researchers, commissioners, practitioners, and members of the public. We will explore this further in the papers going forward and seek to identify the context within which these alternatives work and do not work. Finally, one of the main challenges of conducting this review is the somewhat unnatural approach to analysing a paper. Typically, when reading a paper and seeking to identify outcomes, you would look to the outcomes from the intervention, for example, increased well-being or decreased loneliness. However, the outcomes here are not stated as clearly, posing a challenge for analysing the papers. To address this, we are engaging with an expert advisory group to provide support to the review, and also looking at reviews taking a similar approach in different domains, such as economics research. Going forward, we will continue to review all of the papers within the subcases, seeking to identify themes and context mechanism and outcome configurations. We will continue to build the program theory for each of the subcases, before integrating these subcases to draw meta-inferences about the program theory and CMO configurations. We will report on the findings and submit the findings for publication in a peer-reviewed journal. These findings will then be used to inform the next steps of the Accord study to develop both the evaluation framework for social prescribing and the reporting standards. Thank you very much for listening to this presentation. Please feel free to send any questions to the email address on the slide, and look out for the findings from this review, which we hope to publish in the near future. Thank you.